Plus, are valley fever cases on the rise? Experts tell us what the symptoms are for both people and pets. Dust storms like this have been a regular occurrence here in the valley the past few years. With the swirling dust comes all that pollen, spores of valley fever, and other particulates that cause havoc for allergy sufferers. We talked earlier about valley fever affecting humans, but how about your four-legged friends? We are here with Dr. Beth Robbins from Deer Creek Animal Hospital to talk about what to look for in our pets to find out if they've been affected. And we have little Monty here as well. Monty does not have valley fever, for the record.
Monty, for the record, does not have valley fever. Monty is a native Arizonan like me, and we see fewer cases of valley fever in native Arizona animals than animals coming from other parts of the country.
That is so interesting. Is that because they are more adapted to it? They've been raised in the elements, so they're used to it?
Or maybe they've been exposed to small amounts of that fungal spore and have been able to fight it off like most animals that have valley fever. They will be exposed to that fungal spore, have flu-like symptoms for a couple days, and then rid themselves of the fungus, and they won't even know they had it.
And you have seen kind of an uptick in cases recently, right?
We have. There hasn't been any official literature yet, but I think in talking with other veterinarians around the valley, we've seen an increase in the amount of valley fever cases we've been diagnosing.
So let's go over those symptoms.
The most common symptom is a dry, hacking cough that won't go away. They inhale that fungus up into their lungs and have a dry, hacking cough. Other things like general malaise, lethargy, weight loss. The fungal spores can actually get into the bone and cause limping. And then in really severe cases, it can get into the central nervous system and cause seizures. My dog actually had that form of valley fever.
And so what can you do?
There's really, you can't diagnose the fungus out in the soil. You just have to know the symptoms and signs to look for to catch it early.
Right. And like humans, there is no vaccine, right?
I think there's one in progress, but nothing has been out yet.
Okay. So basically, it's just kind of medications, treatments in the long run, or maybe short run, depending on your dog?
Yeah, exactly. The treatment, we usually say that fungus doesn't do anything quickly. It grows slowly and dies slowly. So they need to be on antifungal medications like fluconazole for months and up to years. Some animals are unable to rid themselves of that fungus, and they'll be on that medication for the rest of their life. But that's not normal.
Wow, okay. And really, I mean, you can't keep the dog inside all the time.
No, and we don't diagnose as many cats with valley fever as dogs, but even cats that are strictly indoor cats can have valley fever.
Okay, so I posted this on Facebook and on Twitter and got a couple of questions, actually more for the pets than for humans. So Kurt Lauderon wants to know, once you or your pet has had valley fever, can you get it again?
You know, and I have had some cases of animals getting it again, but I wonder if they ever cleared it completely in the first place, and then they just had a rebound infection occur.
And you had mentioned that cats can get this as well.
We don't diagnose it as much as in dogs, but yes.
Right. Justin Virgil wants to know, my dog has it. Any other medication other than fluconazole?
There are other medications. We used to use a drug called ketoconazole that had to be given with vitamin C, and it caused a lot of side effects and upset tummies. Fluconazole tends to be better absorbed and well tolerated by the animals, so we've kind of transitioned over to that one.
You have been so helpful. Thank you so much. And to little Monty as well.
He did
so well behaved.